Hi guys, welcome back to yet another shift, another episode of the biggest, the baddest, the goated medical podcast in Kenya,
Piga Shift Pata Trauma Podcast,
where the shift ends.
but the trauma continues.
I am your host, your girl, the none other than Wangare.
And I'm your host Mo. Karibuni sana, let's get
Traumatized together.
Hi Wanga.
Hi.
Happy New Year. You realize that we had to shoot tangu the whole of this new year. Na sahi tuko Feb. Yeah, we haven't released an episode. So, Happy New Year, guys. Thank you for being with us in 2025 and crossing over 2026 with us. As you can see, we are happy and grateful to be healthy. We are here for another episode. As you can see, we have a guest today. Yeah. Wangari, do you have anything else to say before we welcome our guests?
Hi guys.
Okay. Hi, Collins.
Hi Mo.
Could you tell us who you are, what you do, and it's an honor to be our guest today and accepting to be our guest anyway.
It's an honor. It's a humble opportunity. I don't take it for granted.
Okay.
In the biggest medical podcast in Kenya. So yeah, I'm Collins Wajiro. I am a nurse by profession. Yes, I'm trained. I am a bedside nurse. Yeah, I get traumatized at the bedside.
Okay, that's new because I haven't had anyone say, yes, I'm a nurse. And a bedside one. Or talk like, oh, I'm just a nurse, I'm a nurse. Hawajuangi difference between bedside nurse and other cadres. I'm a specialty ya nurses. So you are a bedside nurse. What does bedside nurse entail?
Yeah, I'm a bedside nurse, and bedside nursing entails more of being with the patient in the hospital, especially at the bedside.
Okay.
Giving medications, taking care of the patients, basically taking care of the patient at the bed.
All right.
Yeah.
Okay. All right. Thank you for coming. So our question today, we will start by our topic. Have you ever been traumatized, Collins? Whether as a student, as a qualified nurse, any place, by who, relative, patient, and how did you solve it? How are you able to manage it?
Do you really want to know my trauma?
Yes, of course.
Won't you
We're
be
here for the
traumatized?
tea.
Won't you be traumatized by
We're
my
here for the
traumas?
tea. We're here for the tea.
So yes, I have been traumatized, and bedside nursing is the mother of all traumas. You fight traumas, and you're sometimes unable to proceed for some few hours, for some few days. Others go for months, but we fight. I think I'll start from the very basic when I was a student, and sijui tuweke PG,
Okay.
not sijui tuweke PG ama tuweke emotional quotient, because during my first placement when I was a student, I happened to meet a young person. She was 19 and she was having an autoimmune disorder. This means that her body was fighting its own, and it was causing a lot of pain to this girl. Well, I'm a man, and hey, the girl was so beautiful.
Oh. Okay.
You're like, no, is such a beautiful girl, this pain.
I know, right?
But 2 days into the shift, the girl complicated, and so I was supposed to be in the resuscitation team. And let me tell you, pressing the chest of that girl.
I'm sorry. I'm not judging. But pressing the chest. Pressing the chest is okay. Let me shut up.
The body code.
Okay. We listen and we don't judge. Go on.
Yeah, this was, remember, this is my first my first placement, my first encounter with patients, and you're being told that you have to press the chest so that you can jumpstart the heart. But no, later I come to learn that it's supposed to be chest compressions. But no, because I have not done that before, what you're supposed to do, you just press the chest. You press the chest, press the chest. I know as we were doing the CPR, the MO intern arrived and found us doing our V2 course there. There are words that he used and they pierced my heart.
Okay.
They were so bad. Remember, we had not been equipped for this. It came as an emergency. Long story short, unfortunately lost a girl.
Okay.
This is 2 days into my shift. You've not been prepared on how to handle losing patients. You've not been trained on debriefing. You just went there. You had really given into the CPR, but unfortunately you lose your first patient. Because yeah, she was my first patient who I was assigned to take care of, to give medications. Yeah, it was really traumatizing.
Okay.
It was really traumatizing.
What did the MO say to you that pierced your heart and maybe crushed your heart into pieces?
Those are words that I can't say.
Say them.
No, you can say them.
Say them. No.
We will cut.
What did he tell you? Is it something offensive to the internet? Or is it like, we are unpacking trauma. Yeah. So, what was it?
He told me to get my hands off the girl and I'm going to kill the girl rather than save her life.
Oh my God.
Yeah, that was bad. That was bad. Bearing in the mind that you kind of liked the patient. She was pretty, you liked the patient, you wanted to save the patient. Maybe hakujua attachment yako na the patient. So yeah. How do you feel about it right now? That you're qualified, hata huyo MO maybe aliangalia with the aspect that you guys are practicing witchcraft.
From the point of me being qualified, I'll start by unpacking the part of the CPR. I think right now I'm more equipped with CPR, so I will be more effective on the CPR. I will be more competent in handling the CPR. I won't be pressing the chest. I will be doing the actual compression of the chest. Also, when it comes to handling of the words, I know sometimes in emergencies comes with a lot of adrenaline.
Yeah.
This causes words to, just spill out of the mouth. I believe I will handle the emotional bit more maturely than I handled then. And also, I think I would now from the other side of being qualified, I would equip my students slowly towards such an emergency.
Okay.
Yeah.
That's nice. I think that's nice. And the fact that umeweza kuamka kutoka the trauma, knowing your part, what part you pray. It's okay. I remember when I was in college, when I was in the emergency unit, casualty. So one time, I think I've ever said this. One time our clinic officer mwenye alikuwa equipped na ER alikuwa anakuja anagonga meza, yo student fanya nini, go there, come here, a lot of things. So one time Nicole like, hey dude manzi, so you just talk to us nicely, we would do that. And he was like, no, wakati wa emergency you don't know what to say, you don't. And I was like, no, tell us, take BP, go there, cannulate, come, do. But telling us, you ladies, some bad words, it's not even fair. And when I finished the rotation, hata hakunisainia logbook because ni kama nilikuwa nimechoma. And right now I feel like it is not bad to be corrected, hata kama ni student, as a registered nurse, as a NMO intern, you know what I mean.
Yeah.
Being correction inaweza kuja kutoka kwa any person, and it is good to take it in a wise way, in a good way. Yeah. Do you have anything?
Yeah, I have a question. Like to Collins. Like at that time when he said that, like he told you like some really bad words and then you lost a patient. How did you feel at that time? What did you like? Where did you get the motivation to come to the ward the next day? Is it because you are forced, or how did you cope at that time with that trauma? Because say maybe there's a student somewhere who has been told, ama a person of higher experience has used coercion on them, and they're like, how would I handle that now that I'm a student and my voice probably don't count? Na as him confront, how did you get over it at that time?
Well, I at that point, the options are 1, if not 0. You have to show up. So for me and the traumas that I've faced, that one being the first one in the medical field, I think it's just been a build-up of, you have no option, you have to show up. But thanks to God, I have friends. I do debriefing with friends. I do talk a lot. I do speak of my traumas. And lately I've found a funny way of letting off my traumas through sharing of memes.
Oh.
Yeah.
I didn't know that. I think the last time we released an episode of how do you cope with your traumas. I think we talked about very many things: alcohol, venting, crying, but we didn't talk even about memes. Okay, that's a new one.
Yeah, I do share out my experience in memes. Yeah, and as I'm laughing with the memes and as I'm sharing off, I love my traumas. Yeah.
You love your traumas. Yeah, I love my traumas. I'm almost scared.
He loves.
Loving? What do you mean you love your trauma?
Ama nipate content.
Wewe umesema. Nimesikia I love my traumas.
No, I live my traumas.
Oh.
Yes, I live my traumas.
Okay. Which is I don't know. But I think like as a qualified person, as Collins has said, even if no matter kila siku mtu akiapply kazi anasemanga I can work under pressure nini, there's a certain time I remember we had a patient saito nikiwa mtu mkubwa, I mean nikiwa qualified.
I mean you're still big.
Yeah,
ulikuwa mdogo.
Nikiwa mtu mkubwa, we had a patient that had like refractory hyperkalemia. It was not going and he went into acidosis and it reached a point that we had to escalate patient for care to ICU. So at that point we were like, we want to shift potassium to those stuff, and then we didn't have like salbutamol. Now we had another patient who had the same issue, and then the attending doctor said, sijui what, you're just supposed to give sijui this drug sijui. He said we're supposed to give calcium gluconate once in 24 hours. So that patient that had the hyperkalemia that you are escalating had gotten like 3 doses of calcium gluconate. So before we escalated him, someone said situmrane calcium someone said situmrane calcium
we are going to blame trauma.
Trauma.
Yes.
It's not easy sharing trauma.
Yes.
It's not easy.
Yes.
Yeah,
it is
it's
not.
Okay, Wangari. It's okay. So you decided to give the patient another dose of calcium gluconate, right?
Yeah. So I was like, before we give, doc amesema we're not supposed to give. Again, someone akaniuliza, Wangari, can you work under pressure? And colleague, literally say I'm working under pressure. I Saka like nikamwambia naweza work under
Pressure.
Thank. So akaniambia hapana, wewe huwezi fanya kazi under pressure. Niko like okay, what do you mean? Have I been rude to anyone? Ama have I conducted myself in ways that do not suggest that I can work under pressure? So I wanted to ask you guys as fellow medics, like when we say working under pressure, like what do we mean? Like what do you mean like I can work under pressure? Okay, I know like work can be hectic and stuff. You can have a lot of patients, a lot of things to do. But during an emergency, that's a time of pressure. How do you ensure like umework vizuri under pressure, not offending anyone, sticking to your roles and stuff like that?
Okay. Okay. I would say, my opinion though, working under pressure requires a teamwork. Man, you need to teamwork, communication, and also availability of resources. You cannot ask for something that is not in the ward. You cannot ask for a certain medication that is not in the crash cart. Alafu often nimekwambia, no doc, we do not have. Alafu you're like, what do you do, nurses? You CEO, what's your work? No. There must be, everything must be there. Yeah.
Kole?
I'm going to just add on to what Mo has said. With all the resources, with all the teamwork, we need well-defined roles. Because if you're the one who is doing chest compression, then someone else should be doing circulation. And if someone else is doing circulation, another one should be on the time. And above all, you think we need to have a team lead who will be able to coordinate all these things. This will avoid, umetoa chest compression, umekuja circulation, umesahau ulikuwa circulation, umeenda kwa kuangalia time. In the process we are losing, and this is an adrenaline junkie event here, and utajipata tu umesema kitu, umeambiwa kitu yenye itakuumiza. So I think with well defined roles, we're good. We will minimize the chaos.
Okay, noted. But in that case, unajua nilibaki nikishangaa like mbona ameniuliza ameniambia I can't work under pressure. Okay, like nimekuwa composed, relax, I've talked, I've said what I feel, and then you come and ask me, okay, alini traumatize juu I felt, stop laughing. It is not funny. I felt like unani undermine.
Yeah.
What do you mean ati siwezi work under pressure? Like literally, like what do you mean? I've been in the game for long. Telling me I can't anyways.
You believe in yourself.
I trust myself.
If someone says they've been in the game for long, that is salute.
Boom ni salute.
Salute.
I know. Yeah, so like don't undermine people. Undermine. Msiangalie chini kwa watu. Even that student maybe ajui what he's doing.
Yeah.
But after that muite kando, mwambie you can go first, read the theory, then come and practice.
Yeah.
Or I can teach you how we do things, but not shouting, not saying things that are not pleasing to the ears.
No.
Sometimes back, not even sometimes back, I think last week, I was nursing a patient with meningitis. So the patient came from another facility, and then alikuwa on meds. Of course, alikuwa amemwanzisha. Once you start medications, that is, antibiotic, you don't stop until you take, and then you take the CSF analysis. So the person who was seeing patient came and he was like, no, I've stopped this because of this and this, and I was like, damn, man, I think I need to go back to books, because I see the last time I checked, we do not stop the medication. We continue with the antibiotics and until ile time yenye itafika tujue kama ako nayo ama hana, lakini we complete the dose. And I was like, okay, I need to go back to, cause sometimes to make people feel comfortable around me ama around wanting to know the truth, kama ni ukweli ako right, na mwambianga manzi, si we look kwa ChatGPT kama ni ukweli. We can confirm kwa ChatGPT, because sometimes I'm like, okay, huyu ananiona my 2 cents as you give. So
Yeah.
tuende kwa ChatGPT, but the end goal ni kupea patient the best care.
The best care, sure.
Yeah.
Sure,
Yeah.
sure. And also I feel when we are handling the medical field, no one is a monopoly of knowledge. The students 1 cent will add on to your 2 cents, will add on to the MO's 3 cents,
Yeah.
and that will become 3 plus 5 plus 1 will
Yeah.
become a 6. No. Will become a 9. I mean, if we also add the 1 cent from the patient, or rather from that significant other, we'll do a holistic care to the patient.
Yeah.
So yeah, it also helps in boost confidence.
Yeah. Kali, do you have another trauma yenye sasa ukiwa mtu mkubwa, or anything you want to share, or how has been, okay, apart from decentering your career right now, decentering your bedside career, what are the nitwaje ita what ya
Mundu no hene trauma igituherie.
yapere sasa natukwikira okay, cut. No taking back. Kole,
Yes.
what have your expectations since you joined medical school and right now? Has they risen ama zimesink ama how do you feel about the nursing career? Would you advise your young one to pursue nursing?
I sometimes decide to take a deep breath on that, because it's something that is evolving within me. It's something that is changing and has been changing for the last many years I've been practicing. First is to deal with my expectations. I think I got into this field with very high expectations, especially into scope of practice, and scope of practice, resources available, and also the pay. But then you get to the field and you realize the three are not matching.
That's true.
Yeah, because at some point you'll find you don't have the resources. At some point you'll be forced to work outside your scope of practice just to make sure you have given care to the patient. And remember, in this case, you're being told you're the advocate. And by being an advocate, you'll have to do, if TV high function, we chukua skuru wende ukaunde stima. If bafu zina leak maji, chukua pipe wrench, or just do something about that. Also, if I would advise someone to take nursing, I think at the point I'm standing today, nursing is a wide field. It's a very wide field. And yes, I will advise one to take nursing.
Okay.
Yes, I would. But don't get into the, don't get into the career, or rather into the field with one mind. And I think that is where I believe some older and these age nurses go wrong. Because I think we're getting to the field with a narrow mind of, you're getting to the field, you get to the care of patients. But again, this care of patient is so wide. We're talking about bedside, we're talking about teaching, we're talking about clinical instructors, we're talking about QM.
Okay, philosophy.
We are talking about, medical law. We're talking about advocacy, nurses advocacy, patient advocacy. I mean, there's just a lot out here.
Yeah.
Yes, and
credits.
Yes, yes, and also there's even
what is that?
There's
reproductive health.
Yes.
Okay.
There's no, in the career there are other subspecialties that you can decide to venture in. Yeah.
But now, as they venture in, they need also to check the market, in the employment field.
Yeah.
Do you have anything for Kole? Kole, is there anything else you would want to share with us?
Well, if given another episode, I will come. I'll share.
Okay. Um, let's go back to hapo kwenye tumeongelea about you would like advise people to do nursing. It's okay, like you know. Oh, diraka haha. Oh, nasema like okay, huh? Oh, let's go back to pali kwenye umesema um you can advise someone to do nursing, which is okay. There's no problem. But before you go to those subspecialties, before you go to that credit, you go to that advocacy, you have to start at a point, which is maybe like they say you need like some experience, which is okay. The pay is also something to factor in, which is okay. But these days I've been going like I've been checking the internet a lot, and I'm seeing like medics generally, the doctors, dentists, sijui who, and everyone is saying someone kwanza today someone tweeted on Twitter, is there a course that can pay you more than the dentistry? And then I was like, okay, I'm interested. Let me check the comments. And then people said like, okay, we're summer, but now the job market is another thing. Another person said, actually, I can see, someone said about graduating with medicine and surgery, and they said actually, watu wana graduate for medicine with medicine and surgery but end up unemployed, so they are killing my dreams and I'm in 5th year of med school. And then someone that I follow who is a doctor commented there and said, you don't have to be employed, because if you get employed maybe you get poor pay, or if you get employed you are like limited to, as in uko underrated, like as in your worth hawafiki worth yako juu it's not, yani like umespend like more than 200k in nursing school only to be paid 15,000. That's crazy.
Yeah.
So I feel like if you would advise someone to do nursing or to enter into a medical field, just tell them everything plain and unfiltered. Mwambie, so are you can come, but be ready for anything. Employment sahi iko huko juu, because there are a lot of graduates, doctors, nurses, pharmacists, sijui lab techs, watu hawana kazi. Mbona? Because even at the counties, like even like the old people that should be at home, wengine bado wako jobs, instead they let us work, this us the young people, like the job market is flooded in all the cadres. So I feel like as much as you are advising someone to take a medical course, mwambie kila kitu sawa, you enroll yourself in nursing, in whatever you want to do, you do it. But graduates ni wengi. Okay, unemployment has been a problem, but sahi being unemployed is crazy, ni stress tupu, kukosa kazi. So I feel like okay, hata ukiadvise mtu mwambie tu ukweli, because I believe most of you here mulifanya kazi, muliingia nursing juu maybe someone motivated you, or there is money in the field, or the title daktari nini nini, you know, stuff like that, which is okay. But vile umesema, hata Mo you said in another episode, the expectations were there, but vile uliingia kwa job market zikakuja chini. So let's tell people the truth. Acha watu wakae wakijua ukweli. It's not a walk in the park, it's not a bed of roses, it's crazy. It's like now when you graduate hivi, kwanza someone said ati mkigraduate mnavanga gown ya black to show you how the days will be dark.
The dark days ahead.
To show you the dark days ahead, which is true by the way. Una graduate hivi, the world is waiting for you there with unemployment.
Yeah.
But they say if you have a job you should be grateful. Juu si rahisi. Yeah. Hiyo ni yangu nime preach.
I remember ukiongea nimekumbuka my sister said that she's praying God and she's hoping that, you know, when she gets employed, she'll be employed in a county job, not private like us guys. And I was like, we do a lot to get, okay, people do a lot to get into that county space. So in our episode, we will try and, you know, explain the challenges we've gone through our own stories, through other people's stories on how they have shared their traumas in getting jobs at a better place, greener pastures. Yeah, guys. And with that, what do you say, guys? Bye.
Bye.